There's a back pain eliminated. That's the topic today. Every day we do these videos, and with these videos, our goal is to give you the tools for you to make better healthcare decisions. So these are stories about our patients that came into the program and what happened to them. They get better. But doctors, this is key. This is important. What we have is different. We can help patients that couldn't get help any other place, including surgery. We don't do surgery. We treat patients that have had surgery that didn't get better. And there's a whole story there. We're going to do that next week because that's a really good one. Doctors are not obligated to report their results. So because they don't report their results, you have no idea what to expect from a specific therapy. You just hope it gets better, and I'm pretty sure the doctors that treat you hope it gets better. But hoping is not a very good solution. So today's case is 184, case study 184, 56-year-old female with back pain and sciatica. And somebody said to me, well, 10 years of back pain, if it's not a lot of back pain, what's the big deal? Well, this patient had a lot of back pain, so it is a big deal. And we're going to talk about the numbers in a minute. But suffered for 9 years. In 9 years, one of the things we know is the longer you have the back problem, the more of the degeneration you get, the degenerative cascade. As it degenerates, it progressively gets worse. Even if you don't have pain every day, what happens is it progressively gets worse. But we know she had pain every day. Before she saw us, she had seen 3 different doctors recently, had 3 cortisone injections, not gotten any better. What was the outcome? Not very good. Was taking pain medication, narcotics, and had gone through multiple episodes of physical therapy and did not get better. Why did they not get better? Why did these treatments not get her better? Because the treatment didn't match the problem. You need to match the treatment with the problem. These didn't solve the problem. That's what we do. This is the goal of our video every day. We have been treating patients for 23 years. We've treated 10,000 patients, anywhere from soccer moms to Hall of Fame football players and everybody in between. And during this 23-year time, we've identified 9 specific steps. And when the patients go through these 9 specific steps, they get better. One of our steps is to educate you, which we're doing now, but another step is where we identify what's going on and causing the pinching of the nerve. We specialize in sciatica. We treat more sciatica than anybody, and we treat it successfully. And we have a study published in December that identifies that we treat it successfully better than anybody. So she came in, degenerated disc, bulging disc, stenosis, all of them pinching the nerve that exits the spine, and that pinching of the nerve as it exits the spine will cause the pain that goes down the leg. There are 5 reasons. She had 3, but she had the 3 bad ones, and mostly these are all part of the degenerative cascade. First one is the degenerated disc. Disc breaks down, gets pinching of the nerve as that nerve exits the spine. Bulging disc is like a flat tire where the tire is starting to push out on the outside. That's the bulging disc, and that will pinch the nerves. And she had stenosis, which is a narrowing of the opening of the spinal canal. When you narrow the opening of the spinal canal, the spinal nerves get pinched. She had this, okay? She had the 3 reasons. When she came in, her back pain and sciatica was an 8. And her Oswestry Disability Index was a 56. The Oswestry Disability Index is a score for your level of disability. It's really a percentage of how disabled you are. So in her case, she was 56% disabled. The disability means that you cannot do the things that you want to do. Simple things become a problem. It's a questionnaire about everyday life. How does it feel when you sit? How does it feel when you sleep? How does it feel when you work? How does it feel when you walk? How does it feel when you drive? All the activities you do every day. This is a variable of how severe the problem is. Okay? This is a serious problem. This is not a simple back problem. This is a serious problem. Anything above 40 is a candidate for surgery. Okay? Anything above 40 was a candidate for surgery. She was a 56. I came across some information that I want to share with you. Typical patient that goes into outpatient physical therapy. Their score is a 22. Where is that? Here's a 22. It's slightly above minimal. It's called moderate. Typical patient that goes to a chiropractor is a 27. A little bit more than, a little higher in the moderate zone, but still moderate, not even to 30 yet, not even halfway there. Typical patient with chronic low back pain, which is what she had, is a 43. So she's worse than a 43. Typical patient with sciatica is a 45. She had higher than that. Typical patient that goes to an orthopedic surgeon is a 47. This is a serious back problem. We know that she didn't get better with physical therapy. Why? Because she's above a 22. She didn't get better with the injections. She didn't get better with the narcotics. She was on her way to surgery. It's called the ping pong ball effect. Keep bouncing around to provider to provider. This is what was happening. Came in to see us. What happened? She went from an 8 down to a 1 for her back pain. Okay? Her Oswestry Disability Index was a 10, considered asymptomatic by the standards of the Oswestry Disability Index. Whoops, going fast. 4 years later, we call her. 4.5 years after our program, call her. How you doing? She said, you know what? Best I felt ever. Best I felt ever. Okay? Oswestry was a 0. Back pain was a 0. Sciatica was a 0. Got her life back. Became more active, continued to get better. So when I say 10 years of back pain, it wasn't 10 years of simple back pain, it was 10 years of complicated chronic back pain. Absolutely 100% candidate for surgery. She got better. With our program, we have tools. We have a 9-step process. Our tool for you is so you identify and you know that you can get better. If you like what you're hearing, I want you to subscribe to our YouTube channel, follow us on Instagram, and follow us on the Twitter. We're here for you. We're here to answer your questions. If you have any questions, you can ask us questions, and we'll answer them. Now, we have a video tonight. It's about the 10 fascinating facts of sciatica. You're going to like it. We're going to be live. We do it live every day. So that's it. I'm out. Thank you very much. Have a good day. Be safe. Drive safe. Enjoy your lunch. Chew all your food thoroughly.